The Director General of the WHO declared the COVID-19 outbreak a public health emergency of international concern on the 30th of January 2020, and later in March he characterized it as a pandemic. What is the current situation of the outbreak in Nigeria, and how can we effectively engage community health workers for an appropriate response? We have Mr. Solomon Cholom, a medical virologist. He joins us via Skype from Jos. Thank you so much for joining us on the program. I want to begin by asking, what is staring us in the face is Joheso's threatened strike. We have the Association of Resident Doctors who are on strike at the moment. But do you think that with all of this staring us in the face, that we have integrated, or rather started integrating COVID-19 protocol services into our healthcare system, especially, given that we have established community transmission that's ongoing?
Well, it is very unfortunate that these strike actions are happening at a time like this. And the government must just necessarily sit up to, look into these, issues. Clearly, this speaks of the healthcare policies, the healthcare, basically the attention our government gives to healthcare services, especially with regards to the welfare of, healthcare personnel. So I want to call on the government to quickly look into these grievances and get the workforce back on track. Now, looking at it, basically, we need to actually integrate a whole lot into our, healthcare services as the new normal. Basically, what calls for attention is issues that have to do with, basically infection prevention and control strategies. We don't have to leave our hospitals open for people to just come in and go out. There has to be, basically to erect infection prevention barriers right from the entrances of our hospitals to ensure that people, come in using face masks, to ensure that movement is restricted. Basically in Jos here, there are some engineers that have come up with, a decontaminating machine, which, that in itself is going to go a whole lot to institute this. The machine, if positioned, at the entrances of places, is able to first and foremost take the temperatures of people digitally. It's able to also screen those people wearing face masks and those not wearing face masks. And within it, there is this decontamination going on there. Whereas you must also have a hand sanitizer within to sanitize your hand before it allows you to enter. So if this, machine is installed in, the premises of hospitals to allow for passage and, exit, is going to go a long way to screen, as much as possible digitally, people going in and coming.
So essentially instituting infection prevention barriers. We'd like to thank you, Solomon Cholom, medical virologist. Thank you for joining us at this time.
Thank you.